Welcome everyone. My name is Madeline No and I'm with NetHope, and we want to welcome you to another NetHope Solution Setter webinar. Today we are talking about designing digital tools for COVID-19 response for and with the user. And today we are welcoming presenters from USAID, UNICEF, and Alma Major. Before we get started, I'd like to go over a few housekeeping guidelines for our session today. We'd like you to keep this an interactive session. Please post any questions or comments in the Zoom chat window for our Q&A session toward the end of the hour. And please look for a follow-up email later today that will include a link to the recording for this session and collateral for today's session as well. And toward the end of our session, we would appreciate it if you would complete our webinar satisfaction poll. The questions just help us create better sessions for you for the next sessions, and we appreciate your feedback so we can make these webinars better. And with that, I will turn it over to Sonia Rutzel from Catholic Relief Services.
Thank you very much, Madeline, and thank you very much, NetHope, for facilitating this webinar with us. This is part of the virtual ICT4D Conference, a series of different online events during this year. Yes, as Madeline said, today we will address how to put people at the heart of our decision-making processes, and especially in this design of digital technologies and initiatives in general, and particularly to support the digital COVID-19 response. So it's my great pleasure to introduce you to our speakers. We have Meg Camp. She's the founder and principal consultant of Alma Major. Fatou Wouri, the emergency specialist for digital engagement at UNICEF. Jacqueline Carlson, a senior ICT policy advisor at the US Agency for International Development. So thank you very much for joining us and for sharing your insights. I'd like to also remind the audience, if you have any questions for the speakers, please put them in the chat, and please be aware that we will share the slides afterwards, so you don't have to worry about taking notes. And with that, it's my pleasure to hand over to Meg Camp for an introduction to user-centric design. Thank you, Meg.
Thank you so much, Sonia, and thank you all for being here today. I'm really honored to be joining you. My name is Meg Kemp, and I'm a lecturer at the Maryland Institute College of Art, former humanitarian worker, and the founder of Alma Major. We're a design research and strategy consultancy focused on inclusive and human-centered design. Next slide, please. Next slide, please. I wanted to start today really by just focusing us with this one quote from Frank Chimero. He is a software developer and design thinking leader out of New York. People ignore design that ignores people. It's a simple concept, but I think that it's really just a great frame of reference for us as we enter into this conversation. Next slide, please. So we're all operating from a place of fear right now, outside of the rational parts of our brains, and this includes our users. We're in a situation where things can and often will be changing rapidly. And because of this, you might find, I know that I've found in my practice that some of the digital tools that I was working on previously or was planning on working on now need to solve for completely new user needs or something new altogether. What we thought we knew or what we used to know versus our current reality has changed. And because time is really of the essence here, I wanted to share a few tactics for user research and user-centered design in this context. And if anyone would like to chat more about this, please do reach out. Next slide, please. I'm proposing rapid user needs assessments. I think this is something that we can all do right now. We can all rest assured that among all of this uncertainty, that the snapshot that we had of our users is no longer valid. I really cannot emphasize enough the use of the word rapid. This is a highly dynamic crisis and information needs are incredibly time sensitive. And I think that we'll find, or have already found, that everything that is usually kind of tough about user research will only be made more difficult in this crisis context. So we're going to face new challenges in engaging stakeholders, user recruitment, and scheduling. So really minimizing the research lift will help us get to the stage of delivering faster. So I'm also proposing speed over rigor, which I know is a little bit uncomfortable sometimes, but I think in this context it's appropriate. And then a concept that I'm hearing in user research circles at the moment is the concept of minimum viable research, or minimum viable ethnography. That's the MVR or MVE that you see. And probably we're all familiar with the concept of minimum viable product out of software development, but I'm asking the question, what is the minimum viable research or minimum viable ethnography you would need to do to update what you already know about your users to the current context? Next slide, please. And then just some practical tips just to keep in mind as you engage in these activities, everything in crisis context, and also keeping in mind informed consent and trauma-informed user research at the moment. Trauma-informed user research is a relatively new concept, but I do encourage you to do a little bit of research, and I have some resources at the end of the presentation for some folks that are really starting to dig into this as a concept. Next slide, please. So this is a 4-step disaster management process diagram that is likely very familiar to all of you, but I think this is relevant across all activities during COVID-19, including designing for and with the user. Right now we're in response, but I think that there are things that we can do in the preparation and mitigation phases that we can activate now. Next slide, please. I would propose developing a crisis response user research plan, because we know that this is far from over and that the ripple effects we're going to see for years and years. And also a contingency user research plan. And what I mean by that is we can think through what are some of the potential events and which of those events will affect our user experience. From there, you can go ahead and plan your rapid user needs assessment from a place of potential just touch points that really would affect your user experience for any of the digital tools. Next slide, please. And at Alma Major, these are some of the remote user research tools that we use regularly. I know that as a user researcher, I was always used to and preferred really to do as much of the research as I could in person. But there's a new suite of tools that either are brand new or have been refined to be utilized in this context. And I'm a huge fan of DScout. It's really pretty new to the scene. It is a bit of an investment, but I do recommend it. It is really a great kickstart for remote qualitative research. And it's great for recruiting and refining really specific demographic sets for that research. Also video conferencing, things like right now we're using Zoom, definitely not to be overlooked. This is really great for usability testing also, because you have the ability to record system audio and the user's speech and screen at the same time as you're observing them actually use the product and take notes. Also for remote design workshops or remote user research or user journey mapping workshops, I can recommend Whimsical, Mural, and/or Miro, which used to be Real-Time Board, if you're familiar with that. These tools really make remote workshops possible in a way that they hadn't been previously, and it makes assimilation and coding of the research really easy. You don't have to transfer any of your handwritten notes. You can just tag them right in the system, so it really helps to move quickly. Next slide, please. I wanted to just round out my part of this conversation with this question. What would the world be like if it were designed by and for its full demographic spectrum? For me, and at Alma Major, design equity is the concept of considering and researching the full audience at multiple stages throughout the design process, and being accountable for all of the stakeholders, not that it's just the ones that are paying the bills, right? Design equity and design justice is a growing community of practice that aims to ensure a more equitable distribution of design's benefits and burdens. And it's really gaining a lot of momentum. I think that the impact of having a limited set of voices in the room where design decisions are being made has far-reaching implications. And we're seeing that now more than ever. I just wanted to encourage everyone to keep this question in mind as we all progress through this crisis together. The choices that we make and the voices we include will shape the systems of the future, honestly. Next slide, please. And I just wanted to leave you also, I know that the slides are going to be shared after this conversation, a set of inclusive design resources. I can really recommend the Design Justice Network and the Design Justice Principles. I'm a member of the Design Justice Network, and they're doing really great work in this area, and also the Research Justice Network. Next slide, please. Thank you all so much. Again, my name is Meg Kemp, and thank you for having me.
Thank you very much, Meg, for getting us started and also for sharing such a wealth of resources for us. Next up, I would like to ask Fatou Wouri to share her lessons learned from using YouReport for the digital COVID response. So Fatou, over to you. Thank you.
Thank you, Sonia. Thank you so much, Meg, for opening. And good morning, good afternoon, good evening, colleagues. I'm really delighted to be here today and share a bit of our work and a bit of our approach and perspective. My name is Fatou Wouri, and I am the emergency specialist on the YouReport global team, looking at digital engagement in emergencies. And currently for the COVID-19 response, I am the coordinator for the Digital Platforms Working Group, which is a cross-sectorial working group within UNICEF that looks at positioning digital platforms for the COVID response. And I'm really happy that my colleague Hira Hafiz Rahman is also here with us today, and she will, I guess, we can also ask her questions when we get to the Q&A part. UNICEF has a 70-year history of innovating for children. We really believe in investing in new approaches and partnerships and technologies that help support to realize children's rights that are really critical to improving their lives. At UNICEF, we've always partnered with tech companies, startups, governments, and academia to address the biggest challenges that face children and youth. We've been doing this since 2007, specifically making those concentrated investments with a proven and ongoing track record of success and failure. I mean, oftentimes during crises and emergencies, one of the main challenges governments and organizations face, including our implementing partners, is providing the right information to affected populations at the right time. We know that new ideas and simple tools like mobile phones remain one of the most powerful tools to communicate with people around the world. At UNICEF, we use technology and all types of new approaches to achieve three really important things. One, to provide life-saving information and services, to ensure that we're increasing access to essential services. We are using scarce resources more efficiently, and we are always communicating life-saving information and as much as possible reaching the last mile. We believe in engaging young people as a second priority, really ensuring that we're connecting them to their governments, as well as opportunities to ensure that they're future ready. At UNICEF, we try to help meet children's needs today and tomorrow, and we do that by identifying emerging technologies, conducting research, experimenting with new approaches, and investing in early stage solutions. So one of the solutions, which is UNICEF's flagship program that I'll speak about today, is YouReport. Basically, YouReport is a real-time mobile empowerment and community engagement platform for young people and communities. And I will talk a little bit about how we went back to our toolboxes to then see what would be most applicable and position that for the COVID-19 response. Next slide, please. So for those that may not be familiar with UReport, like I said, UReport is one of UNICEF's flagship social messaging programs. And, it is a powerful real-time mobile data collection and community engagement platform. We like to say that UReport, even though it's powered by UNICEF, is for the people. It's owned and operated by NGOs, UNICEF, and we partner with government. It is anonymous to the user. Over our close to a decade lifespan, we've evolved from purely SMS-based to now being integrated across all the major social media platforms like Facebook Messenger, Viber, WhatsApp, etc. And we really ensure that we are accountable and transparent. And UReport, for anyone that's used it or has engaged with it or has interfaced with it, is used for many different things. We use it to measure awareness, campaigns and attitudes. We use it for social research, reducing the distance between constituents, the people, and government. For disaster preparedness, this is really my role currently, behavioral change, counseling, understanding demand, responding and providing services, and really anchor that in the principles of empowerment. Next slide. So to date, this social messaging tool that can be accessed via SMS and every other and most digital social media platforms, we now exist in 68 countries. Every 30 seconds, a UReporter joins the platform. We have over 350 global partnerships, and we are growing at 11 million plus. We have 80 actions each month, meaning across the 68 countries, we have a coordinated sort of action to our constituencies. And UReport can be found in all the major channels. And when we talk about it really being transparent, the data that we collect in real time is displayed on public websites at country level. Users have access to it on to access one-on-one advice. And we always map our platforms by location, gender, and age. And we can specify and target groups that way. And of course, UReport is run by a committee of partners. Next slide. So what does this mean in light of COVID? When, earlier this year, just in February, we were just trying to understand the disease itself. We went back to, like I said, what we know best, as opposed to creating new solutions, was to really amplify and design what we know best and ensure that people are at the center of this design. And so we work with our Communications for Development team, which are a team of social and behavioral scientists, to really ensure that we anchor this conversation in community engagement principles. So ensuring that we understand the community's culture, social networks, we're establishing relationships, we're building trust with formal and informal leadership, we're recognizing and respecting the diversity of community rights-based approaches, understanding that community feedback is paramount to planning and designing this response, the tool for COVID, and that community collaboration really does require long-term commitment. And we know that UReport, we've positioned it as a trusted tool. And so we worked with that team to really ensure that from the onset, we're designing from a people-centered approach. Next slide. What we were then trying to ensure that we do in collaboration with our Communication for Development team, and then looking at how we anchor this within the Accountability to Affected Populations humanitarian framework, which is an active commitment by humanitarian actors to use power responsibly by taking account of, giving account to, and being held to account by the people that we seek to support. So once we sort of ensure that we are taking this from a people-centered approach, we are committed to ensuring that we not only listen to the needs of people, that communities have access to the information and the communication channels that they need to make informed decisions and stay safe, but that this feedback is then used to inform the response and response actors, and that we are held accountable to the people in which we're engaging with. Next slide. So what does that mean? From February to where we are right now, we started, we pulled out WHO public health messaging from earlier this year, and in collaboration with our Communication for Development team, our emergency team, and the AAP framework, and looking cross-sectorally across the organization, we developed a COVID-19 information chatbot. When we launched it in February, we had about 150,000 users, and today we are at 6 million million users, 6 million people accessing this chatbot across 52 countries that have deployed it. And we have a growing 7 million bot interactions. What is really unique about the UNICEF COVID information chatbot is that it's country and localized driven. Next slide, please. So what does that mean? If we look at how, WHO's Health Alert has gotten a lot of support, it's very language driven for the most part. It's excellent, but anyone, anywhere in the world can access the same information. What we've done with our COVID information chatbot is ensure that we integrate it within SMS, Viber, Facebook Messenger, WhatsApp, Telegram, but we've customized it to ensure that it supports new countries and programs to help them deploy it in a localized way, to scale in a localized way, and to gather real-time information that is pertinent to their governments, their countries, and that community. What this COVID information chatbot continues to do is tackle misinformation and rumors for digital linkages to improve community engagement. We've been using the COVID information chatbot to assess and measure secondary impacts of COVID in the lives of children, young people, parents, and communities. And we are dedicated to continue to reach millions of young people and communities with essential information. I want to really clarify that we do have the COVID information chatbot does have a global platform, meaning anyone in the world can access that information through UReport's global portal, but that across when we say it's been deployed in 52 countries, we mean 52 countries have customized it, have developed local referrals for it, have supported governments, and are working very closely with governments and partners and communities to ensure that every information around COVID, every referral, every assessment is pertinent not only to their country at a national level, but at community level as well. Next slide. I am probably running out of time, so we have a couple of examples of what this looks like at country level, and how we continue to. This is an iterative process that is really designed with young people at country level. So Côte d'Ivoire, for example, is one of the most exciting stories to date. Next slide. The first thing that they did when we were able to sort of deploy the COVID information chatbot with that had public health messaging, what is COVID, what is it, how do you prevent yourself, etc., is that they customized it. The first thing they did was solidify their partnerships with MNOs. So they went to all the big MNOs in Côte d'Ivoire, got them all on board, and had access to 32 million young people in Côte d'Ivoire. And as you can see from MTN, Orange, and Mokov in Côte d'Ivoire, they were part of using UReport messaging from the COVID information chatbot to send COVID-related information in Côte d'Ivoire at the onset of this pandemic. Over. Next slide, sorry. And so what have we seen? We've seen over 2.5 million consultations, and close to 1 million unique visitors visiting this COVID chatbot. And within that, in Côte d'Ivoire, the COVID chatbot has been able to provide self-evaluations, information on self-evaluation, symptoms, treatment, prevention, awareness around stigma, things around fake news, and the measures taken by government. And this has resulted in, next slide. What's really important to us is that from where we see the most success stories is when there's government uptake for public health messaging like this. And so we've seen the Ministry of Health and Youth Affairs also develop polls on this COVID information chatbot, really verified and endorsed it as a reputable and reliable source of information, which has really contributed to the spike of engagement with the COVID information chatbot. We see that in the spirit of transparency and accountability, we see that the polls from the COVID information chatbot are published broadly in local news outlets in Abidjan, as well as we see an uptake of radio engagement in terms of accessing information from the chatbot, and also sort of the feedback that's coming from people interacting with the chatbot. Next slide. So what have we learned? I mean, in Côte d'Ivoire, from 3rd of March to 3rd of May, we saw an uptake of a growth in the platform from about 1 million to 2 million. So close to 1 million people within 2 months signed up to be reporters because of the fact that the COVID information chatbot was so useful to them. And so we begin to see that in emergency context, people are demanding reliable information, and your report and the way we've positioned it along with our partners and government has played a crucial role in serving as an official source of information that are provided by trusted authorities, and people have responded really positively to that. And so if you go to the next slide, and I will stop here, and I'm happy to give more examples. What's really, really exciting about what happened in Cote d'Ivoire and in other parts of the world is that this is really an iterative process. It is co-designed with young people. The feedback is what is taken into account to shape messaging, to shape offline engagement, and to ensure that young people know that their leadership and their actions is adding value to this response, and that the government and authorities are hearing their voices and responding accordingly. So thank you, and Hira and I are here for your questions, and I'll stop now. So over to you, Sonia.
Thank you very much, Fatou, and sharing your impressive work. And yeah, very excited to hear more about it. But I really like to first offer our attendees the option to ask any questions. We will have time for those in our Q&A part. But first, we have one more speaker at the first part of our session. It's my pleasure to introduce Jacqueline Carlson, and she will share some insights from USAID on lessons learned from designing digital tools. Thank you, Jacqueline.
Great. Thank you so much, Sonia. And hello, everyone. It's wonderful to be with you today. My name is Jacqueline Carlson, and I am a technology policy advisor at USAID's Center for Digital Development. So today, although it's about COVID, I wanted to talk about a story that took place in Liberia in 2014. And it's a story that I imagine may resonate with you today. So if you will, please come back with me to 2014, pre-COVID, pre-social distancing, sort of, where the Ebola outbreak in West Africa was just beginning to take off. Next, please. So what was happening? Information was difficult. Health workers were working with the best info that they had, their own long-term knowledge, and the best materials that they had, as were the central decision makers who were downloading information from one system, downloading information from another system, putting the information together, and trying to build a larger situational awareness, pulling all those information streams together. So within this context, the Liberia Ministry of Health deployed mHero. So what was this? This was a text messaging service intended to support communication with its remote health workforce. And similar tech had already shown results elsewhere. In Uganda, a similar system, mTrack, was used to facilitate a quick response to contain outbreaks. And they did that through a variety of methods supported by mTrack, such as polls to understand what was happening where and what materials were available at different clinics for response. Next, please. So this slide is for the techies out there today. Our session is certainly about designing with the user, but to me that doesn't only mean how a tool is used, but it can also mean how the architecture is shaped from the beginning. So mHero was built out of existing systems that already were deployed. So we have DHIS2, which is a routine health information system, district level. We have IRIS, an HR system, already deployed at the Ministry of Health in Liberia. And then we have Rapid Pro, which was already kind of discussed with Fatou and had previously been used by UNICEF to power a U-report in Liberia. So mHero took these existing systems and tied them together. We just needed to add some shortcodes and a number of other pieces, of course. Next, please. So this is a bit of a fast forward, but the system was designed with the principles of digital development in mind. And something that we really learned from the Ebola response is that many digital data systems deployed were not sustainable beyond the response due to those solutions not being locally generated Also, perhaps because of limited activity timelines, we certainly saw a resource cliff after a number of years during recovery, and then limited investments in building local country capacity to maintain and control those systems moving forward with local vendors. So next, please. So if you previously fell asleep with the words interoperability and architecture, you can come back now. So one of the core assets of mHero to the ministry was that it was flexible. So as other systems came online over time during both response and recovery periods, as Meg talked about earlier, one of the big powers of it was that they could plug into this interoperability layer and then be used to message health workers about needs related to other information systems. So for example, about pay notification, about stock out alerts, etc. Next, please. All right, so what has the ministry used this service for? For outbreak alert information, systems of a suspected outbreak were sent to 4,400 health workers along with a phone number to call if a patient presented symptoms. It has since been used to communicate about the symptoms and response efforts related to COVID. And this was part of really a multi-channel response, which I think is really important. Some of the questions from the attendees today talked about, okay, what if people do not have internet or do not have smartphones? How do you reach those people? And of course, SMS is not the only channel. It's really a comprehensive community engagement campaign that would also have to involve radio and in person. Harder now. All right, next slide, please. So over time, it's been used by over 16 departments at the Ministry of Health. Some of the biggest champions were the mental health unit, supply chain management unit, and others. And I think what's interesting to this is that it can also be used not just by the Ministry of Health, but by other ministries. And UNICEF with Rapid Pro has engaged ministries of education as well. Next, please. And one more. So the process to create mHero was often done remotely, and this was not ideal. But team members were in North Carolina, and Tanzania, and Monrovia. The team was composed of IntraHealth and supported by UNICEF, and really came together with the ministry to act as one team. And because of this, we sat down afterward and reflected on what our process of implementation was. That metaphor of flying the plane while you're building it during a crisis is really relevant, I think, to now as well as then. And so it's nice to be able to sit down afterward and think through, okay, what would we do differently? So this was the approach that we took together from an unpublished paper that we have contributions from the different stakeholders on. And if we did it all over again, we would add a few different boxes. So 2 at the beginning would heavily emphasize more conceptualization with local government and a lot more integration of user-centered design techniques. Certainly not easy during social distancing, but still possible. And the other things that we would have added is at the end. So we would have stacked more boxes on the end process. So that would include feedback to health workers. When you source information for people, you must put it back and tell them how it was used, even if it's later. Also, feedback surveys were conducted with health workers as well as the units that use the tool. But it would be great to have these done on a more rapid basis. And I'd be interested to explore some of those rapid research techniques that Meg talked about in the first presentation. So in conclusion, based on lessons learned here, the kind of history of this platform mirrors other lessons learned during Ebola response. I think moving forward, what can be useful for development partners is if they are able to help identify, support, and develop digital platforms and assets that are essential to continuity of government services. So really working with local stakeholders to identify those from the beginning. At the beginning of health emergencies, we often see a lot of the resources, including time and money, really oriented at health. But what other essential digital systems are essential to the continuity of government services. Other ways that partners can support is to identify private sector assets. So for example, call centers, local data analysis and tech firms. And just to emphasize that designing with the user, even when in a rapid moving, changing context, it's just so important. So establishing and keeping asking questions every month. How will users be consulted during the design process as the situation changes? How can the system be adapted around users rather than forcing users to accommodate the system? What are the user's existing media and communication preferences? In an emergency, we see that digital tools that are not as intuitive will not be as effective. And that is the end of my presentation today, and thank you for your time.
Thank you very much, Jacqueline. And yeah, thank you for all the very insightful presentations. We now would like to enter into a Q&A session, and thank you very much for our attendees for posting the questions in the chat. Please continue to do so. We'll try to combine some of those, and I will address the question to one of the speakers first, but I also really like to invite the other speakers to offer their insights as well. My first question is for Meg. Meg, in addition to the requirements of working remotely in the current environment, what are some of the new challenges with MVR and MVE in general, human-centered design? What in your opinion has particularly changed over the from the 3 to 4 months ago? Sorry, I know that's a difficult one to start with.
Oh yeah, thank you so much. So thank you, Sonia and Frederick, and to Batu and Jacqueline, also really excellent presentation. So I think that it's really about acknowledging the psychological challenges and for some, unfortunately, trauma that is occurring right now at a global level. So HCD, human-centered design, and UCD is all about building empathy with the user from the start. And I think that empathy really matters more than ever, and really just making sure that that step isn't skipped. And yes, with all of us working remotely, I think it means that it's a bit more difficult to ID nonverbal cues when you are co-designing with the user or doing user research, and when conducting any HCD or UCD activities. So I think it requires a new sensitivity for those of us with that privilege to be in a space of designing processes and tools, that we really are spending the time and sensitivity with users at that level.
Thank you, Meg. Fatou, we also had a number of questions with regards to the content of the EU report. So there's a question how the content or the information coming in is being curated, and if any international NGOs can customize the content to optimize value for local communities and users.
Great, thanks, Sonia. Thanks for those questions. We've been collecting them. I'll hand it over to my colleague Hera, who is the EU Report Global Coordinator. This is her bread and butter. So maybe Hera, you can take this question. Thanks for joining.
Yeah, hi everyone. Thank you, and pleasure to be here from the EU Reports team with Fatou. So just coming back to your question on partnerships, like Fatou mentioned in her presentation, that we work with over 350 formal and informal partners across 68 countries. And traditionally, we partner with both global and local partners through MOUs, which is one of the most effective ways to scale up the platform, engage the users, and eventually utilize the information for program and policy change and influence. Traditionally, or usually, since Europort is primarily a youth-focused platform, but it is also present and is being scaled up for communities as well, specifically in emergency context. So we usually partner with large youth-led organizations or NGO that play a critical role in various development issues or topics that we work with. and partners who have high membership, good communication in place, enthusiasm for the program that we're working with, and of course, an understanding of working with and for the communities as well. And coming back to the question on the content, so I assume that this content is, just as an example, when it comes to the content that we are sharing specifically for COVID-19, this content has been developed in coordination with organizations such as IFRC, WHO, who are part of the COVID-19 Secretariat with UNICEF. And this content is being shared and scaled up in partnership with the NGOs that we work with on ground, and of course with the government as well. And in many countries, this content is official part of the official communication of the government that has been gone out and is considered as, you know, a key platform to engage with communities and hear their issues. And if Fatu, if you want to add on anything here, please be like.
Yeah, just really quickly, I think Hera did a really, thanks Hera for that, and that's super clear. And just to crystallize it a little bit more, in our country office in Mozambique, your reports manifest differently based on the country. We take into consideration the political landscape, the trust, access to digital platforms. We take into consideration SMS penetration. So it really depends. It has its own unique manifestation in each country, deployment in each country. If you take an example, if you take a country like Mozambique, YouReport, it's not, we don't call it the YouReport platform, it's called SMS Biz. And it's done in collaboration with the government of Mozambique, UNFPA, and local partners. So think about implementing partners, collaborating partners, the program is designed around the sexual rights and health of young people. And it's done in collaboration with local implementing partners, with UNFPA, government, and us. And within the system itself, within YouReport, we have been very intentional about ensuring that we can co-create with partners. And so we have a You Partners feature that enables partners to also access our users, to also engage with communities, to see data in real time, and so that there's a spirit of co-ownership and collaboration in the work that we do. Over.
Thank you very much. I'm glad you mentioned already your collaboration with the governments. That is, I think I would like to ask Jacqueline that as the next question, but I really also value the insights from our other speakers as well, particularly working with the government and the ministries of health. How do you say your initiative fits within those e-health policies in the countries?
Yes, that's an excellent question. And if we redid the process of implementation map, I think that aligning with not just the ministry's strategy for health information systems, but the overall whole of government approach to interoperability would be a key first step. As they evolve, I think it's as e-health strategies within countries and interoperability and data sharing protocols and privacy protocols evolve, I think one of the most essential first steps during a crisis response is to identify those essential national policies and then share those amongst the stakeholders. And I think that's a essential role that donors have to play as well, is to share them amongst themselves and their implementing partners to make sure that new systems align with those while protecting users' data and privacy. Over.
Thank you. Meg, could you also maybe share some insights from your end around partnerships, maybe either specifically with governments or maybe with other organizations?
Sure. I guess in this space, it's important really just to make sure that when you are partnering at that level, that you are coming to like a baseline understanding prior to really reaching out and planning on implementing any tools, or who are you really, I think making sure that you have, if you don't have the same end users, how are you going to lead the research, or how are you going to get to a space where you all have a common understanding of what their actual core issues are? Over.
Thank you.
Okay.
Yeah. Yes, please go ahead.
Would you like us to respond to this question as well? Because I think it's come up a couple of times around data privacy and protection. Here will jump in. But as you know, our platform is aggregated data from all users, and then that's further disaggregated by location, gender, and age. But Hira, please, I think it'd be great if you could go into depth in terms of what that means for the COVID-19 chatbot, the work that we've done cross-divisionally to ensure that there are very clear ethical considerations at this time, not only on our global platform, but also at country level. So over to you, Hira.
Sure. I think, this is a really relevant question, especially now where everyone is turning into digital platforms to reach out to communities and to hear what they, to hear their feedback. Specifically when it comes to the data protection and privacy on Europort, like Fatu mentioned, all the data on the platform is anonymous, and the phone numbers are hidden even from the admin users. And to keep the system anonymous, we don't ask for names, we don't ask for phone numbers, to ensure anonymity on digital platforms like Facebook or WhatsApp, the handles are not visible on our backend platform RapidPro. And before we refer messages to a third party who have to refer messages to the third party in terms of sharing the data with them, we need to ensure that a proper partnership and a legal agreement is present to be able to share that data, not just with the government but also with the partners that we're working with. And one most important point here is that all the data that we share, or the data that is public, it is aggregated. It's like 1 million people sharing their views on for example, whether they have proper water hygiene and sanitation facilities available or not, yes or no. One more important thing specifically that came out, especially for COVID-19, where our team has really strongly focused on, is the ensuring ethical guidelines on while making sure that the partners who work with the platform, or even UNICEF offices who are utilizing the platform on the ground, and these ethical guidelines have clear articulation and clear instructions on do's and don'ts of the platform. Or from the platform security side of things, of course, we follow UNICEF ICT's security platform requirements, where the most important point to share here is that both business owner, who is the data controller, and the service provider, in our case, the vendor that we work with who manages the platform, they share the obligations for ensuring proper implementation of the security requirements that, of course, they abide by when we share, through TORs or through MOUs or through contact as well. But if anyone has any other questions or would like to get into detail, you can get in touch with Fatu and myself, and we can link you up with the with the focal person in the ICT team who manages it. Thanks.
I just want to add something really quickly before I hand over to you, Sonia, because I think Tala is asking really pertinent questions. And just to clarify, the data is disaggregated. Europort is completely an opt-in platform, right? Our responsibility is to our users, is to young people, is to empower them, and we pride ourselves in being transparent and accountable. So, users are asked to opt in, and when they do opt in, we frame and what the platform is and what how the data is used, and we ask users not to provide their age, right? To provide their gender. Are you male? Are you female? How old are you? Because obviously for protection issues as well, in certain countries, young people, there are legal ramifications to engaging with children under 13 or 12. So in most, we follow country protocols in terms of child protection policies, and for location, where are you located? And sometimes it depends on if we want to get really granular and ask what chiefdom, what district, and that is all uploaded in real time, and it is readily shared information. So every user has a unique number. We have no idea who they are. We just know their age, which is uploaded in real time, their gender, and their location, and that's all aggregated on any Europort website at country level and global as well. Over.
Thank you so much for already taking care of some of these questions. That's fantastic. Since we will be talking about yes, a gender-specific question, I also really would like. I know that Meg and I think also Jacqueline, you've both done a fair bit of work on your initiatives and how digital initiative can help bridge the gender gap. And I would like to see if you have a couple of words for us, particularly with regards to the COVID pandemic and maybe either specific challenges or also if this is maybe also an opportunity now being more user driven to help us close the digital gender gap. Meg, can I maybe ask you first, and then Jacqueline, I would also very value your thoughts. Thank you.
Absolutely. Thank you, Sonia. I do think that with COVID, it's really we're seeing the discrepancy in the gender data gap and like in a whole new light right now in this context. And I think that some of the challenges that I'm seeing and some of the folks that are really leading in this space, I don't know if anyone here is a member or is familiar with Women in Global Health, but that's an organization that I think is really just showing us all of the data around where there really is truly a large gap. And I think that one of the initiatives that I've been in partnership with them is Operation 50/50. It's a campaign to make sure that women's perspectives, considering that they are making up about 70% of the workforce in COVID response, and not really as much as the decision-making power, that their perspectives are being accounted for, because it's being proven that it's really saving lives for them to be, their voices to be heard in this scenario. I do think that one of the specific challenges that maybe everyone might be familiar with, but is even just in the design, and this is a design problem as well, but like the design of PPE so often is not actually fitted for women, and they are responding at a higher rate than men. However, the equipment that they're being asked to use is not really comfortable or safe for them. So that's a specific design problem that I've found, I mean, unfortunate, but really fascinating, and an opportunity for us to think through design decisions, even at that kind of granular level, how much of that ripple effect really occurs. Over.
Yeah, just to add on that, I mean, this is such an essential topic. And as there's been so much body of research in academia already, that when we digitize systems, it often amplifies existing power dynamics, as opposed to addressing the gender digital divide. So we actually had a blog just posted today. I'll share the link in the chat. It's on marketlinks.org, marketlinks plural. And it talks about some of the considerations within COVID and how there are risks to exacerbate the gender digital divide and how we could be able to address them. So just to highlight some very high level key considerations, and this is on applying a gender lens to digital development and COVID-19. Is to really consider how to approach data collection with a gender lens, to not put people at risk, to examine gender dynamics around access and use of technology. So as implementing partners and donors and governments work together to be able to share different resources, as still taking consideration into privacy, but to share data resources on gender access to different communication channels and the internet would be a key first step. Thanks. Over.
Thank you very much, Jacqueline. There was a question that I sort of missed earlier when we talked about government engagement. I think particularly since we're also talking a lot about localization and local leadership, Jacqueline, do you think will the ministry be in a position to take over the mHero tool, or have they, since this was from 2014?
Yeah, it's an excellent question. So mHero had kind of two dual purposes, and one was to be effective in providing information to the ministry and to its health workers. So that was the primary goal, and where a lot of the resources were focused during that first kind of phase of implementation. But again, I think if we did it all over again, we would also, although you're still limited where you put your resources, but we would still put more emphasis on making sure that the costs were fully understood and communicated from the beginning, and also explored engaging local vendors more closely. The ministry is fully running, and it has from the beginning, fully run the governance structure around mHero. What they haven't been able to do though, or that's not the right way to put it, how the system is set up right now. So they're the ones that are controlling the information that goes through it. The implementing partners do not have a say in that. That is fully up to the ministry. And they are the ones responsible for the data collection and the analysis. But the ministry, as it's set up now, goes through implementing partners to reach the vendors. And so as you can imagine, that's just one more step kind of removed from the process. So I'm interested as the time goes on, how local vendors are going to be brought into the picture. And I think there'll be an opportunity for a podcast in July from Dial, from their Principles for Digital Development team, to feature the Ministry of Health representative who's really leading this program. Over.
Excellent, thank you very much. And my last question is, again, looking at the issue around being fully inclusive. I've had two, this is a question for you. What have UNICEF done in scaling up your report services for those without access to mobile phones?
Yeah, thanks for that. And I think this ties really nicely into, the groups that are hard to reach. It has the gender component. We have an accessibility issue. We have a literacy issue. We have a trust issue. And we always believe the way in which we speak about UReport from our global team is that, UReport is only as strong as the program design and the partners that we work with and the context in which it can flourish. What does that mean in real terms? It means that we are very intentional, especially during COVID. We don't have the time to come up with new solutions, but we can re-engineer the structures that UReport already thrives in. So what does that mean? What we've always been intentional about is ensuring that there are many countries wherein UReport is designed to support those who have access to mobile phones to get the information, and then to ensure that they are fully integrated and supported and appreciated within the platform as ambassadors to then share that information with their communities. We see that in Mozambique. It's a very, very clear model. We have youth ambassadors, youth leaders that we train, we support, we facilitate, we nurture, and their job is to be able to be the conduit, the voice for other young people on issues that matter to them, so that when they're sending information in, they're very clearly articulating that it's their question and also that of their community. So we've already built this really strong community structure, youth structures, religious structures, the community engagement piece, media, journalists, government, CSOs, implementing partners, everyone has a stake in this. Therefore, the information that gets to those that have access to it, we then try to ensure that, there are structures in place that they are then conduits and they're then facilitating that the discussions and the information that they're getting to their communities that cannot reach that. That's not perfect. We understand that the digital divide is real, and the gender digital divide even more so. And so sometimes what we do in context is where UReport can't go, we work with other platforms like Internet of Good Things that has 0 rated features to be able to reach more people. And we also understand what the limitations are. The fact that a tool like UReport for COVID-19 can thrive in a place like Maiduguri in Northeast Nigeria is telling, because we're working with camps, in camps with internally displaced peoples, and everyone that has access to a phone is then a community leader and passing that information on. Just wanted to say that, and to also say that in our features, when we talk about reaching girls, we are very intentional and very clear that in order to reach women and girls, we have to invest beyond just the technology, but the ecosystem that can enable us to just even a little bit bridge that digital divide. So I'll stop there.
Thank you so much, Fatu. I think that was a fantastic closing statement, I can say. Unfortunately, we're already at the end of our webinar, but I really like to thank Meg, Fatu, and Jacqueline for all their insights and the practical examples. And I just like to share our call to action with this group. If you do also have any practical guidance on how you're using user-centric and particularly user-driven approaches for the digital COVID response, please do share those with me, as we're currently looking to compile some guidance. And yeah, we'll love to hear from you. And then, yeah, we'll reconvene here at this platform on Tuesday, June the 30th, when we were talking about health data management and sharing. So very much in line with what Jacqueline has shared with us earlier around operability and responsible data. So I'm looking forward to see you all again here on June 30th. And before you leave, please do fill out the feedback form. We would love to hear from what you thought about this webinar, or if you had any ideas of how we could improve those. So thank you very much for attending. Thank you to our speakers, and a big thank you to NetHope for facilitating this for us. Have a good rest of your day. Goodbye.
Thank you, Sonia, and thank you to all the attendees for coming to our session today. As Sonia mentioned, we would love it if you would fill out our webinar satisfaction survey. Please give us your feedback so we can make these sessions better. And do look out for that follow-up email with links to the recording of this session, as well as the PowerPoint slides in PDF format. Thank you again for attending, and have a great rest of your day.